insulin resistance simply means that you have a defective receptor, but the good news is that not all receptors are what? Are defective or damaged. Is that good? Yes, to some extent, because so this is defective, but this is okay. Open the door, glucose can go in. This is defective, okay, glucose can go in. But will that also cause hyperglycemia? Yeah. Yes? Okay. Now, in type 1 you develop DKA. What about type 2? What do you develop in type 2 DM? What is it that you develop? You don't develop diabetic ketoacidosis. What is it that you develop? What is HONK? Hyperosmolar non, what is K? Ketotic syndrome, or non-ketotic hyperosmolarity. What does hyperosmolar mean? There's a lot of what? Glucose or concentration of glucose in the blood concentration. What does non-ketotic mean? You do not develop what? Ketones. Why? Because there is still partial what? Part of glucose can still go in. Do you understand? Okay? So these are two important things to remember. Okay? So both of them with hyperglycemia. Here's DKA, here it's HONK. Non-ketotic syndrome. Okay? Now, usually type 1 affects who? Children?
Yes.
Young adults or older people?
Children.
Children and young. That's why they used to call this juvenile diabetes, because it affects young children and young adults. What about type 2? Elderly, 40 years and above. Do you understand? Okay? Now, again, the treatment here, can we give insulin to type 2 patients?
Yes.
Yes, we can. Why? Why would you give insulin to type 2 diabetic patients? Okay, the answer is simple. You lack insulin, you give more. There's only one key, you give 8 more keys. Here's sir, I'm going to inject you with insulin. You only have one key now, I will provide you with what? 8 extra keys, courtesy of West Coast University Medical Center. Do you understand what I'm trying to show here? What is exactly what you want us to develop? Critical what? And what exactly is critical thinking? Common sense. What is common sense based on? Knowledge. The lack of knowledge is dangerous. But the more knowledge you acquire on your own or with my help, can that transform your life to become successful nurses? I'm not trying to brag that I can help you become successful. It's really on your own what? Effort. Remember what they said before? Genius is 99% perspiration, hard work, and 1% what? Inspiration. Whose perspiration? Yours or mine? Yours. When I was a young student, at 10 years of age, I would wake up at 4 in the morning just to what? To watch television or to study? Because I was driven at the young age of 10. Are you? Not now anymore. Okay? I wake up at 4 just to watch television. But I used to do that, right? As early as a young boy. Went back all the way to college because I was driven to be #1 in the class, right? Same thing with you. You want to be #1 in your own class. You don't care about the other people in this class. Well, you do, but what I mean is you want to be successful, learn all these things. Okay, now, what else can we give type 2 patients aside from insulin? What else? Can we give oral hypoglycemic agents?
Yes.
Hypoglycemic agents are drugs that can what? What can it do to help these people with type 2? Yes?
Lower the blood sugar.
How?
By adding.
See? How? Where? When? How? Why? Yes? What's your last name?
Angeles.
Angeles. What is the answer? Anybody who knows? Yes, yes?
It helps the beta cells increase production.
Of course. Remember, the beta cells, they can still produce what? Not all are defective. So these drugs, the oral drugs we prescribe our patients, are designed to stimulate the beta cells to produce more what? Because they produce little. Do you understand? To produce what? More insulin. Does that make sense? Okay. But can these drugs be helpful in type 1? The oral drugs that we give our patients in type 2, can they be helpful in type 1? Why? Why not? Yes? Yes? Anyone? Yes, Brian?
B cells.
Hmm?
No, the B cells are not working or they're
All the beta cells are destroyed, Brian, right? Is that what you're trying to say, Brian? I want you to be more precise, Brian. No B cells, okay?
Yeah.
It's not even B, it's called beta cells. Okay? I want you to be perfect, Brian. Perfect. It's not called B cell. It's called what? Beta cell, right? Okay? Why are there no beta cells? Because they are completely what? Destroyed by the autoimmune mechanism. So these drugs will be useless. Because they're supposed to stimulate beta cells. How can you stimulate something that's not there? Do you understand? Okay. Do you understand? I hope you understand what I'm trying to say here, okay? Now, what about gestational? Diabetes in what? Pregnant women. And very often the babies that they have will be what we call LGA. What is LGA? Large for gestational age. 10 to 12 pounds. You have a choice on how big your baby would be. Is that good or bad? Very bad. Because the baby could get stuck there. So I would suggest what kind of procedure? C-section. Okay, C-section. Do you understand, right? Now, not only that, if you were my wife, I would create an app. Where's my cell phone? I would create an app just for you. Apps for my wife. I play wife, blood sugar levels, wife, baby, fetal heart tones. So I would have Bluetooth attached to the abdominal wall, which has a fetoscope. I'm not kidding. I'm trying to think of something. Because you're my wife, I love you. But I love more my baby than you. Because you have no part of my DNA. But that baby has part of my DNA. Anybody with part of my DNA, I love them to the moon, you know? Because I love my wife up to the bus stop. But my kids, unlimited. I'm not just joking, but I love all of them. So in other words, I will create an app. What for? In diabetic mothers who are pregnant, can the baby die what we call fetal death in utero?
Yes.
I'm not kidding. This happened many times in the past. I have this patient who was 9 months pregnant, about to deliver the baby the next week. We call that EDC. What is EDC? Expected date of confinement. There's a formula that we use. So you get pregnant today, but based on pregnancy test and all these tests, that is absolute positive test. We count, and then we can, oh, you will be expected to deliver the baby, let's say May, what is today, May 18? May 25, okay? And then, can you imagine on May 23, you come to the ER, I cannot feel my baby moving inside. What does that tell you? Could that baby possibly be dead?
Yes.
That's the reason why, I'm not joking. One of these days, I will sit down and come up with an app that's hooked to Bluetooth in the abdominal wall of my wife, and that Bluetooth will be able to detect fetal heart tones. And even fetal, everything, all the works. Fetal heart tones, and hopefully in the future, blood gases, blood sugar levels. Can you imagine the blood sugar levels of both the mother and the baby? Amazing, money, 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 okay. So in other words, you can actually do that. Hopefully somebody will come up with an idea. I have the idea, but I don't have the money to come up with research. The idea here is that a mother who's diabetic, can the blood sugars fluctuate?
Yes.
Can that affect the baby?
Yes.
How do you know the baby is in distress? The fetal heart rate goes up. And the baby will be crying, "Mommy, help, help, I'm hypoglycemic. Help me, please. Do something about your diet. Are you taking your medication regularly, Mom?" That's what the baby will tell. And 2 days before the baby was supposed to be born, "Mommy, I'm gonna die. Goodbye. See you in heaven." I'm not kidding. This happened many times. I feel so bad for those mothers. Why? They're helpless. They come to the ER, they're crying. Nothing we can do. The baby's dead. When the baby is dead, can you resuscitate the baby inside? Can you do CPR? No. You can't. Oh, I think, why not come up with a device too, right? That will create a what? Remember the AED there? So the app that I would create will be able to decide once the fetal heart rate starts to decline, what we call fetal deceleration. That will create what like an electrical surge. Baby, don't die. What happened? What happened? You're alive. These are just some of my crazy ideas, right? I'm a crazy man. Anyway, So is this going to be difficult for mothers who are pregnant and with diabetes mellitus? Believe me. So pray that you will never become pregnant with diabetes, because if you are, I was not joking. If you were my wife, I will really be, I'll be calling you every hour. Honey, what's your blood sugar now? Okay, what was it at 7? Okay, this is, okay, what about now? It's already 8. What's your blood sugar now? I'm not kidding. These women with diabetes, they are in a very delicate situation. The baby could die between the first month, second, third, up to the 9th month of pregnancy. That's really sad. I'm not kidding. I have encountered in my residency training, and especially in my internship in the obstetrics ward, really hard, because it's the family that gets affected, you know. Another thing about the big babies, do not ever tell. One of my friends, a friend of mine, I used to teach in a different school, and she was working there as a secretary. And this was the first baby. She had diabetes. And what happened was they allowed her to deliver by what? Spontaneous vaginal delivery. The baby got stuck. So remember, and I normally do this, remember this? They taught me put both feet on the stirrups like this, and then you let the vagina, the birth push, 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 push. Now guess what? I'm not 10 pounds. You say I can fit this? I can't, right? So what did they do? The baby got stuck, so what did the people at Kaiser do?
Oh my God.
What happened to the brachial plexus?
Yeah.
Ruptured. So the baby had brachial plexus injury upon birth. Remember when you're delivered, you're the baby? So ruptured here, so what happened? Look! Can't move! I have brachial plexus injury. The baby will tell the nurse. Could that have been avoided?
Yes.
All they needed to do was what? Perfect. You're smarter than the doctors there. See? You know what to do, right? Are there stupid doctors in the world?
Yeah.
There are so many, right? So be careful with them, okay? So, diabetes is something that is going to come out in the nursing board exam, so be aware of that, okay? Another condition is the other endocrine disorders on the different chapters. So let's deal first with the most common problem. Cushing's disease versus Addison's disease, right? What is the problem here? What organ is involved here? Huh?